Listen up, everybody. If you are an intern, leave this place immediately. And for you, every doctor who has responsibility in this place should perform his responsibility without let on CSO, if anybody.
That was the scene recently at the University of Calabar Teaching Hospital when some medical laboratory science students who were on training were allegedly asked to leave the medical laboratory. The scene also saw deployment of armed security personnel by leadership of the UCTH to prevent students from using the laboratory, while their medicine counterparts were granted access to use the facility. The alleged undue preference in favor of medicine students sparked a protest which led to the death of a medical laboratory science student, Mr. Patrick O'Neill. Speaking on this, the National Publicity Secretary, Association of Medical Laboratory Science of Nigeria, AMSL, Dr. Kashmiri Fine, says preventing medical science laboratory students from using the medical laboratory in University of Calabar Teaching Hospital and using armed security men against them is a reign of terror. He called on the federal government to immediately address the alleged victimization, while also alleging that the chief medical director, UCTH, is the mastermind.
Their counterpart, students of medicine from the same University of Calabar, were unconditionally allowed to continue with their activity. They were granted access into the laboratory. When these youngsters realized that they've been discriminated against, they demanded for an explanation, which was not forthcoming from the UCTH management. And they had to do a peaceful protest within the hospital and the university premises. Now, following that, some disgruntled, unscrupulous pathologists, resident doctors, damaged laboratory equipment. They used some of the glasswares to stab some medical laboratory students. In fact, as I speak with you, the students are in palpable fear. They have been so intimidated. Students that went on protest, if you go to them now, they are running. We want government to call the CMD and the CMAC to order to end this terror, reign of terror in the UCTH, and to allow the delineated charter for the medical laboratory science profession as provided by the schemes of service dating back to 1972 to 2003 for medical laboratory scientists to supervene in the rendering of service. Our worry.
Dr. Ifeanyi maintains that the preferential treatment given to clinicians, if not addressed, will affect patients who comes to receive care.
Our serious concern is that healthcare seeking members of the public who attend the UCTH Calabar, their life is now in jeopardy because doctors are beginning to go to take over labs to run tests and are not trained to do so. They do not have a licensure to do so.
It is hoped that the Minister of Health, Dr. Sagi Ehanire, and other stakeholders will not treat this with kid gloves. For now, the Chief Medical Director, UCTH, and the CMAC are yet to comment on the sad incidents. Joseph Kadri, ITV News, Abuja.